More now on new Omicron alerts for both Sydney and Melbourne this morning. New South Wales health officials trying to contact 140 partygoers who are on a boat in Sydney after 5 people tested positive.
While the first Omicron case is suspected in Melbourne from a returned traveller in quarantine. For more, we're joined by CSIRO Director Dr Rob Grenfell from Natamuck in Victoria. Doctor, good morning to you. Let's first talk about the suspected case in Melbourne if we can. How concerned should we be by this situation?
Yes, good morning. Well, at this stage, this case is in quarantine and we've been advised that they haven't been out in the community during their infectious period. So that's given us a bit of a reprieve from this current infection, but I guess we're going to hear many more of these going into the future.
So is it inevitable that Omicron will continue to spread? We know how infectious it is.
Yeah, certainly the early signs are that Omicron is more infectious than Delta, and you have to ask yourself how, because, I mean, Delta is so infectious, but it seems to be displacing the Delta variant in southern Africa and also emerging rapidly across Europe as we speak. So I think in one sense we're going to see a lot more of this coming into the summer season and prepare ourselves for just another burst of another variant.
It's been almost 2 weeks, about a week and a half since Omicron first emerged, since it was first identified globally. What do we know at this stage about the threat that it poses in terms of severity and symptoms?
Yeah, sadly, the virus takes a while to actually cause severe disease. As we know, it takes a few days to get infected and then around about another week before you actually do get quite ill. And then from that point, it takes another 2 to 3 weeks before you're actually severely ill. So we have a bit of time to run on this before we find out, is this more severe than Delta or how severe this illness is? And we're watching extremely closely to see what actually comes of this.
That's interesting. All right, well, the boat party in Sydney is also of huge concern. How risky are events like this when it comes to the spread of the virus?
Yeah, look, it's a wake-up to all of us that coronavirus is out there in our community and it's extremely infectious, whether it's Delta or Omicron, and that all large events pose a threat for us. And, you know, as Australians, we've certainly been locked down for quite a long time, and it's nice to get back out to events. What do you do? Well, look, take cautions is one of those things, and be aware that you need to check in so that you can be notified if a case has come out where you are. And if you're not really confident, you can got the choice of not going, but the other part is wearing masks. They are effective in tight spots as well for preventing infection.
You would think that a boat would be a relatively safe place given it's outdoors, but looking at those pictures there, you can see everyone's pretty tightly packed into an indoor sort of undercover part of the boat. So I suppose that's where it makes sense. This morning, Rob, The Age is reporting that on a worrying COVID cluster in primary schools, how critical is vaccinating our kids before school starts again next year?
Look, it's very critical, and it's very pleasing that the TGA has now approved the provisional use of Pfizer in children from 5 to 11, because what's really been holding back the end of this school year has been a lot of clusters in our primary schools, which meant a lot of kids have actually had to spend that time at home under quarantine, and some of the schools themselves have even closed fully, which is very disruptive. So if we can get as many children as possible vaccinated once it's approved, or at least distributed for use, will prevent a lot of these disruptions going into the new school year. So very important to get this.
All right, Dr Rob Grenfell, we really do appreciate your time this morning.
It's been my pleasure.